Here at the Kansas Center for Sedation Dentistry, you may have just had a crown performed. We do this a couple different ways, and there's different reasons for why we would do each way. One way is to place your permanent restoration in one visit, and the other way would be if we prepare the tooth, take an impression or a scan, send that to a laboratory, and have the crown made off-site and then inserted at a later date. If you have a temporary crown, please know that it will not feel or look the same as what your permanent crown will look like and feel like. Typically they're a little bit gritty, although you should kind of forget that you have it after about a week and should be chewing normally and functioning normally. If you have any type of lingering sensitivity or pain that's past 3 or 4 days, please contact our office. It's likely that that temporary may be touching the tooth above it just a little bit heavy, and that's causing your sensitivity, and that needs to be taken care of. That's a simple fix, and typically that's accomplished in less than 30 seconds without anesthetic. So if you're having any sensitivity or pain or problems with your temporary crown or even your permanent crown, please let us know, as it's usually a bite-related issue, even though it may feel like there's something else wrong. Like patients will say that they feel like there's a gap in their tooth, or they'll say that it hurts to cold, not when I bite, so it can't be a bite issue. 99% of the time, these are still all related to too much pressure on the tooth. It gets hypersensitive and irritated because of the pressure, and it starts reacting to things that it normally wouldn't otherwise. You may be numb for a while after your crown prep procedure. You have to be careful not to bite your cheek or your tongue. And so take that seriously and be very careful. We've seen a lot of injury to the tongue or cheek from people that are numb and trying to eat something. Be careful with your temporary crowns if you have one. Sticky foods, very hard foods, can either break a temporary or cause them to come off. They're just made with acrylic, and they're put on with a temporary cement so that we can easily get them off for your second or your insert appointment. The only complications we have usually when the permanent crown is inserted the day of is if you were numb and had your mouth open a long time, your jaw may not be going to a place where we can record it, and we may have inadvertently left it high. So if you're having sensitivity in that case, please call to make a follow-up appointment to have that bite adjustment done, which is a simple, easy process. If you do have a temporary crown, you'll be coming back for a second appointment in a few weeks. At that appointment, typically we do not give anesthetic unless the patient requests it. It's usually a painless, simple procedure. We just remove the temporary crown, which is a funny feeling. And then we set the permanent crown on, make sure it fits, check the floss, the bite, and make sure the patient's happy with both the appearance and the feel of it in their mouth. And then we cement that restoration permanently. You may have temporaries that are stuck together. Your permanent crowns will not be that way. If you have a temporary crown, you may floss it. However, I want you to floss it down and pull it through. People that will floss up and then pull it back down, it's very easy to have that temporary crown dislodge and have it come off. So it's okay for you to floss, but just floss up and then just pull that floss through instead of popping it back down. When we get your permanent crown restored, or the tooth restored with your permanent crown, you'll be able to floss normally again.